%90 of America's adults believe that we are in a mental health crisis. In this bleak landscape, Sanatana Dharma's holistic tradition offers much hope. My name is Dr. Shalini Wahi. I am a licensed clinical psychologist, and today I am honored to talk about the role of Sanatana Dharma in mental health. Sanatana means something that is eternal, and Dharma means the application of the right principles in the right context at the right time and at the right place with the right person. There are several practices within Sanatana Dharma that promote mental well-being. Let us explore some of these. We begin with Ayurveda. Ayurveda is an Upaveda or a body of knowledge contained within the Vedas. The purpose of Ayurveda is to help develop a sound mind and body so that one can pursue the 4 Purusharthas or goals of life outlined in Sanatana Dharma. These are Dharma, Artha, Kama, and Moksha. Ayurveda is very broad and multifaceted, giving knowledge on different areas, including herbal therapies, mantra chanting, and performing homams. The most recognized and practiced aspect of Ayurveda is the preparation of herbal remedies. This is also called 𝓥𝓲𝓭𝓮𝓸𝓟𝓷. An example of this is ashwagandha, a powerful herb for managing anxiety. Today, ashwagandha is widely available world over and has well-documented clinical efficacy. Likewise, Brahmi, another powerful herb, has been shown to help with symptoms of ADHD and improved cognitive functioning. Other lesser-known aspects of 𝓥𝓲𝓭𝓮𝓸𝓟𝓷, which also positively impact mental health, include directions for correct diet and purification and rejuvenation methods such as panchakarma and Ayurvedic massage. The Nasya and Kshirodhara panchakarma treatments have been specifically indicated in the management of generalized anxiety disorder. In addition to 𝓥𝓲𝓭𝓮𝓸𝓟𝓷, a lesser known yet powerful Ayurvedic method of treating mental illness is called 𝗙𝗵𝐹 Some of its practices include mantra chanting, wearing gems, and performing homams. The chanting of Om, for example, has been scientifically shown to be powerful in reducing depression, anxiety, and stress. Finally, Ayurvedic psychotherapy or 𝗪𝗏𝑣𝑗𝑦 also helps improve mental health. To understand this better, let us examine some foundational knowledge. Ayurveda describes 3 gunas of the mind: sattva or balance, rajas or action, and tamas or dullness. Too much rajas and tamas causes mental problems, and so 𝗪𝗏𝑣𝑗𝑦 tries to help increase the sattva guna in patients to improve their mental health. 𝗪𝗏𝑣𝑗𝑦 uses concepts like giving patients insight, support, challenging thoughts, and referencing the spiritual philosophical framework of Sanatana Dharma to reduce mental illness. This was a very brief snapshot of Ayurveda. And now, yoga. Yoga is mainstream and has well-established scientific efficacy regarding its role in improving mental health. When we think of yoga, we tend to think of asanas. But yoga is asanas and much, much more. It is a very vast, complex, and complete system that encompasses the whole person, that is, the physical self, mental self, and spiritual self. Yoga's vastness and depth is seen in its 8 distinct aspects: yama, niyama, asanas, pranayama, pratyahara, dharana, dhyana, and samadhi. Each of these limbs of yoga improves mental health. An example is yoga has been shown to reduce trauma and improve symptoms of post-traumatic stress disorder or PTSD. In fact, yoga is actively used by the US military through a variety of programs such as I-Rest Yoga Nidra. Yoga has proved so useful that the US Army Surgeon General has listed Yoga Nidra, based on research with I-Rest, as a Tier 1 approach for addressing pain management in military care. Another example of how yoga helps mental health is that yoga has been shown to reduce depression, anxiety, and improve sleep. When we do yoga asanas, in addition to the release of endorphins, the lowering of stress levels, and the increase of flow of oxygenated blood to the brain, our brain also increases its release of the neurotransmitter GABA. GABA is very interesting. It's very crucial in improving mood symptoms. In fact, GABA activity is what is targeted in many different ways in commonplace allopathic antidepressants like fluoxetine or Prozac and Zoloft. Likewise, when we do yoga pranayama or yogic breathing exercises like Bhastrika pranayama, research shows a significant reduction in anxiety and negative feelings. Pranayama does this by directly affecting the activity and pathways of brain centers in charge of emotions, like the amygdala, anterior insula, and prefrontal cortex. Moving on to dhyana or meditation. There are more than 3,000 studies that show the benefits of meditation for reducing anxiety, depression, and a host of other mental illnesses. The list goes on and on about the benefits of these popular yoga methods. The perhaps lesser known aspects of yoga, like yama and niyama, are yoga's ethical guidelines and provide a map for the right way to live. When followed, they have tremendous value for balancing the body, mind, and spirit. As an example, the yama of satya or truth and the niyama of santosha or contentment helps us focus on what is true and real rather than superficial and fleeting. It also helps us know when enough is truly enough. Ayurveda and yoga are visible and powerful demonstrations of how Sanatana Dharma improves mental well-being. However, these are just 2 broad tools, and Sanatana Dharma has other offerings to improve mental health that have not been detailed here. One of these is Siddha medicine. Siddha medicine is similar to Ayurveda and it evolved in South India. Another is Jyotish Vidya or Vedic astrology. Vedic astrology is the method of understanding how one's karma is affected by the position of stars and planet energies. Thus, an astrologer could be consulted to understand how one's mental health is impacted by planetary and star positions and what pujas and other interventions can reduce the impact of these negative planetary energies. I conclude by giving you a bird's eye view of the undeniable fact that Sanatana Dharma gives the patient and family many actionable items and intervention points on the journey to mental well-being. I hope you enjoyed this talk. Before closing, however, I would like to say some words of caution. Always remember the mantra, safety first, when dealing with any illness, including mental illness. Never underestimate, ignore, or undertreat mental illness. If you are feeling suicidal or having thoughts of harming others, this is not the time to take out your yoga mat. Rather, call 911 or 988, which is a suicide hotline, or go to the closest ER. Don't mix and match herbal therapies with allopathic medicine without consulting your doctor. Thank you.